bit more time to get finalized so that we can take action and ideally not have to meet again. And I think Sandy, are you there? I saw Sandy a minute ago. Okay, perfect. If you can, let's call the roll at 1:05 of the Pandemic Response and Economic Recovery Committee.
Yes, thank you. When we take attendance, could you also let me know the location you're joining us from, please? Commissioner David Woodward?
Here, Royal Oak, Michigan.
Arsha Gershenson?
Here, Bloomfield Township.
Michael Spiz?
Present, Oxford Township.
Pauline Zach?
Here, Huntington Woods.
Janet Jackson?
Here, Southfield.
Penny Lubes?
Here from Clausen.
William Miller? Kristen Nelson?
Here, Waterford Township.
Shelley Taub?
Here, Bloomfield Township.
Philip Weipert?
Here, attending from South Line, Michigan.
Thomas Kuhn?
Here, Detroit, Michigan.
Mr. Chair, you have a quorum.
Excellent. If everyone can please rise for the Pledge of Allegiance and look at Commissioner Weipert's flag there. And I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everybody. Next, we got approval of the minutes. Can I get a motion to approve the minutes from the November 9th, 2020 meeting? Moved by Commissioner Nelson, seconded by Commissioner Lubes. Any discussion on the minutes? Seeing none. All in favor of approving the minutes, say aye.
Aye.
Aye. Opposed, say nay. Let the record reflect that the minutes are approved unanimously. It moves to approval of the agenda, and per the request of our Chief of Staff that we're going to move item 1 to the bottom of the list to give them a little bit more time. There's a technical amendment that we need to that he's drafting, so we'll just push that to the bottom. So if we can move the agenda with moving 1 after item 3, with everything else. Moved by Commissioner Zach, seconded by Commissioner Weipert. Any discussion? All in favor, say aye.
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 Opposed, say nay. Let the record reflect that the agenda as moved is approved unanimously. And this, we will now move to public comment. And let's check the lines. Hey, Aaron.
Good, how are you? Good afternoon. The phone lines are open. We currently do not have any callers. We have not received any online or written submissions, and the auditorium has no visitors today.
Other than you.
Other than me.
Okay. Thank you. Thank you very much. Seeing no public comments, I'll declare public comment closed. And that will bring us to communications. And for the communications, I've asked the executive team to come and give a COVID-19 update. Specifically, I know there's members of this committee that have also asked not only kind of the status of things as it exists today, in terms of our spread rates, positives, etc. But also any the steps we're taking for preparation as it relates to vaccine distribution. So we've taken some actions here, and we got Leanne Stafford and Tom Hardesty here, so to help kind of update us on all that thing. So I'll hand it over to both of you. Thank you for making time this afternoon to be with us.
Hello, thanks for having us. And I'm just going to get started on the cases, and then I'll turn it over to Tom, and he can give his update. So as of yesterday, we recorded 41,654 total total cases since the middle of March when the pandemic began. Obviously, since October 1st, we have really seen a great increase in cases. And the reason I use October 1st is, as we know, that's when the governor's orders were considered unlawful. And so many things were opened back up. And so right now, our 7-day average is 683 cases per day. We have seen a little bit of a decrease over the last couple of weeks as they implemented the pause. Back in October, we were actually at 66 cases per day. So you can see quite an increase in cases. And for just kind of to think about what it looked like in June in the summer, we were at 9 to 11 cases the full month of June. So daily cases were 9 to 11. So just to kind of put things in perspective. The positivity rate this week is 12.79%, so just under 13%. That is a little bit down from last week where we were at 13.6%. And if you're not familiar with what percent positivity rate is, it really looks at what the spread is in the community. And so we do look at that number. We are cautious on that number as well because many times positives and negatives are not reported to the health division and included in that number. So, those are the cases that have been reported to us at this time. As you've probably heard, our hospitals are continuing to fill up. Back in October, at the end of October, we had 278 patients that were confirmed with COVID. As of the end of November, we had 804 cases in the hospital. So you can see a significant increase. The interesting part of that is they are all adults. They have not recorded one pediatric case. I mean, when they recorded on the 30th, there was not one pediatric case with COVID in the hospital at this time. So, we're continuing to work with our hospitals and, keep them, we talk with them really on a daily basis to see if there are things that they need. Again, we continue to watch that. Something you probably heard is starting on Monday, we have changed our testing locations. So we have gone from just 2 or 3 locations to now we're at 4 and probably be expanding to 5. And so on Monday, we are in Holly. On Tuesday, we are in Rochester. On Wednesday, we are in Southfield. And Thursday, we are in Pontiac. So we're really looking to use the fire stations as coverage for our employees. As we started it at the right time on Monday, obviously with the snow coming. So we've had 2 really good opportunities and showings over the last couple of days, and we see that it's going to work well. We also launched a new portal for individuals that come to our site for testing. They're able to go on to a portal that's provided by our testing lab, Helix Diagnostics. And so instead of waiting for the health division, to get the results back from Helix and then turn them over and call, now the patients that receive tests are sent a text message to say your test results are available, and they're able to log onto the portal and get those results immediately. And so we're looking at a 48 to 72 hour turnaround. So that's very good. So you've probably heard, I know you were talking about vaccine. There's a lot of discussion around vaccine right now. The state is still receiving information about what our allocation is going to look like for the state of Michigan. And obviously, depending on what the allocation is for the state will depend on what we get here at the health division. Yesterday, the federal agency that really talks about who should be the priority, really set the priority yesterday for healthcare professionals and long-term care residents and professionals. Some of the surprise was that EMS was not included in that. So we're waiting further guidance from the state because the state can modify those requirements if they want to and recommendations. So we'll be watching from that from MDHHS. But we plan to use, and we're kind of testing them. The sites that we're using for the testing will be used for our vaccine locations. So we'll be able to, kind of offer vaccine as needed. We'll ramp up and ramp down as we need, depending on, how much vaccine we have. But we have 5 sites where we can offer it on a daily basis. So once we get adequate vaccine and there is a phased approach depending on, healthcare workers are first, and then they're going to continue to talk about what that priority is. We'll be able to offer vaccine in 5 different locations every day. So we are working on, staffing those and getting those ready so that when we have the vaccine, we're ready to go. The CDC just came out with some new recommendations for quarantine. They actually just announced it this morning, so they've actually shortened the quarantine time when you're symptomatic, and it really depends on whether or not you test or you not test. And so we will be updating those requirements and starting to message that out very soon. We're just waiting on some additional guidance from the state on that. They also issued some new international travel guidelines, which really they had said, don't travel. Now they say if you travel, they suggest coming back and testing after, 3 to 5 days after you've returned. And then a quarantine period of 7 to 10 days, basically depending on what your results are. So we will continue and then start messaging on these items as well, especially as the holiday season is here and we expect people to be traveling. And that's one more thing is, as we start to see a decline in cases over the last couple of weeks, we do anticipate over the next couple of weeks, we will see an increase. And some of the modeling shows that our numbers could even double to what we are right now. So we will continue to watch that and obviously provide testing to our full capacity here at the Health Division and others.
Thank you, Leanne. Well, I think I'll hand it over to Tom, and then we'll take questions of Leanne and Tom.
Good afternoon, Commissioners. Emergency management, Homeland Security, continuing on our support role with the pandemic. PPE has been at the forefront since the beginning of this. We have certainly seen an increase in use and requests for that over the course of the last few weeks, which matches up with the increase in cases. We continue to be in pretty good shape with one caveat, which has been over the course of the last couple months with medical grade gloves. We do have a stock and we do have supply. We're just going through them and working, purchasing has been working diligently to make sure that we maintain that supply. As that is the kind of the new masks were the issue earlier this year. Gloves is that issue now. So, but we are in pretty good shape with most everything, including we do have a stock of gloves. We're working to secure that 5th site for testing for health. Actually, we've talked to Lyon Township. They have a fire station on the east side over near 10 Mile and Milford Road. That goes to their board on Monday. So we're hoping to receive approval there, and that will give them a 5th site, as well as looks like we have some alternative sites if need be, either as backups or if have the ability to expand vaccinations later to a couple other communities. So working to make sure that we have those plans in place. The number one question I get every day is, where are the freezers? We actually got notification today that they are coming off the production line this week. They will go, we don't buy them directly from the manufacturers. We get them from an intermediary. We'll go to them, and then shortly after that to us. So I don't have a delivery date yet, but we were originally told right around the first week of December, and it looks like it will be pretty close to that timeline. So we'll continue to watch that and stay on top of it.
Great. Thank you both. Again, thank you for the update and explain that we are, very much still in the thick of things, in the wake of Thanksgiving and anticipation, at least all news reports that we expect some uptick that's starting to show now because of and those that did not follow recommendations and Thanksgiving holiday. I know, I mean, it was stressful and strainful not to be with family. I mean, like normal years, but it's good to hear that we've got like things in place to not only continue to support testing, but also the preparation of vaccine deployment. Let me open it up to questions from commissioners, and then we'll close it out. So Commissioner Zach, followed by Commissioner Spitz.
This question's for Leanne, and I know we don't have details on vaccines, but do you foresee that government will get a certain amount of vaccines and private industry will also get vaccines differently? You know, like when it came to the shingles shots, for example, that were in short supply, you know, the CVS's or the Rite Aids were getting it maybe faster than we were getting. Do you see the same type of thing happening when it comes to this vaccination? You're on mute.
You're on mute, Leanne.
How many times have we said this during every visit? So I think what we're going to see is hospitals obviously are going to receive the vaccine first, right? So they're going to start there. Local public health will be provided vaccine as it becomes available, right? Because we're really going to focus on the remainder of the community. What the federal government has done, though, is they've set up contracts with some pharmacies to focus on some of the vulnerable population, so the long-term care facilities. So these pharmacies will work to vaccinate both the patients and the healthcare workers inside of these facilities. So taking off the burden, right, from public health and, you know, kind of distributing it across because pharmacies are able to do that. So I anticipate public health will actually get the vaccine first. That's what we're hearing. And then once there is some built up, then we will start bringing in pharmacies to assist with that vaccination. For us to do 1.2 million people, we need lots of people to have access to the vaccine, right? So I expect that in the spring, it will be distributed to private distributors, you know, additional pharmacies, and then local public health will also be, you know, working to, you know, work through the community.
My next question, do we have the staff capacity to handle the projected, you know, increased vaccination level?
Yes, and so we have worked through our staffing plans. We know we're going to need, you know, some additional staff, and we're working to, you know, bring those individuals in, especially for, you know, like registration, because, you know, this is a very contagious virus. And so we're going to be doing, just like we've been doing with testing, is vaccination by appointments. And so we'll be looking to bring staff in to help with those appointments. And we feel that based on what we've done for testing, for the nurses and the staffing to give the vaccine, we are well staffed for that. But we're going to continue to monitor that. And as we get into the spring, you know, if we need additional staff, we have some great staffing companies that have provided us nurses. And we will, you know, we will continue to watch if we need additional staffing.
Thank you, and thank you for all that you're doing for us, and Tom too. Thank you.
Thank you, Commissioner. Commissioner Spitz is next on the list.
Thank you, Mr. Chair. First question I have is for Leanne. You made comments about the case rates increasing, which I think everybody's aware of. But if you watch the death rates, I think they're staying relatively flat. So my question is, you also mentioned a model that you have seen for the cases. Has there been any modeling done on potential death rates going forward?
Actually, yes. Actually, Dr. Faust was just looking at this, and they do model that it could be double for the fatality rates too. So, you know, again, they're not sure, but they're anticipating, because as the cases increases, you know, the potential for fatalities, you know, increases. So that modeling is the same. I know the state health department, even though we have not seen, you know, the deaths in Oakland County, I think they reported their most deaths since the beginning of this yesterday as they were reviewing records. So we're continuing to watch that. At this point, we've seen minimal, right? That
right.
they're getting better with the clinical care in the hospitals. But, as they become more overwhelmed and the hospitals, get to capacity, we start looking at similar situations that we did back in, March and April. It's just overwhelming number of people that are coming in. And so that is the modeling that we did see on Monday.
Okay, thank you. My next question is for Tom. You mentioned we have supplies, Tom Hardesty, that we have supplies, but gloves are on the shortage. Are we supplying anything to hospitals these days, or have they all solidified their supply stream?
We have not had to supply the hospitals recently, although in a conversation with Dr. Faust yesterday, there was some concern that hospitals are seeing a short supply of gloves. So part of our original stockpile plan was to make sure that we had enough for county employees to support our communities and at least a short-term supply for hospitals. So we do have about a 2-week supply of most things for hospitals, including some gloves. And to try to have a longer term of that would be a pretty significant number, but to try to fill gaps for them. But we have not had any recent requests from hospitals. They've been okay.
Great, thank you. My third question was on freezers, but you already answered that. Thank you.
Great. Thank you, Commissioner Spiz. Next on the list, I have Commissioner Kuhn.
Thank you, Mr. Chair. I just had a quick question for Leanne. Does the health department look at hospitalization doubling rates or projections?
Yes. I mean, what we have been seeing, the hospitals provide this information to us. They have, really doubled over the last 2 months. And so we anticipate, like I said, as there's more cases, that can continue to be. When we know back in April, at one of the heightened times, there were over 1,000 cases in our hospitals. And so I know hospitals are reaching out to us to continue to offer the messaging, that people need to continue to wear their masks and socially distance. But yes, that is something Dr. Faust really watches our hospital numbers and talks with our the emergency departments and those in the hospitals that are looking at this. And so that is a continued piece of data that we're always looking at. And we do anticipate that the hospitalizations will continue to rise as the activity that we saw over Thanksgiving.
Thank you very much.
Thank you, Commissioner. Next up, I got Commissioner Tom.
I don't have any questions, but I really, really want to thank Tom and Leanne. I don't think this is what you signed up for a year ago or when you became a health officer. It's something you studied in the books, Leanne, I'm sure, but never expected to have it. Thank you for your untold time, your effort, your energy. It's truly appreciated, I'm sure, by all of us. Thank you.
Thank you.
Thank you, Commissioner. Next, I have Commissioner Lubes.
Hi, thank you, Mr. Chair. I just want to verify that there is no date yet for the health department to dispense any vaccinations. And if not, do you, in any conversations, do you have an estimate of a timeline?
So the state has anticipated that Michigan will have vaccine by the end of the year. And so what they're waiting to determine is, depending on the amount of vaccine we receive, is it all going to be pushed to healthcare to start with the frontline workers? Will local public health receive a minimal amount? That's what we're waiting on the state to provide to us. Again, I anticipate that if we receive vaccine, it will probably be around the first of the year. But again, they kind of update us. On Thursdays and Fridays, we get a little bit of an update as they receive more information. Now that federal agency came out yesterday, we may receive more information at the end of this week and be able to provide some more guidance.
Thank you.
Thank you, Commissioner. Any further questions? I've got just a couple here, and Leanne or Tom, whoever would make the most sense here. So are all all the sites going to be eligible for doing flu vaccinations as well in the interim, or are we keeping those? I guess from a flu vaccination stuff. I mean, I know there's been a lot of talk of making certain that we don't compound this, the seriousness of COVID with flu spread, compounded the overall problem. Can you, I guess, around the flu vaccination, I mean, obviously a nice test run for deployment of this in a massive rate. Kind of, can you speak a little bit like where are our flu vaccination rates, and then will these mobile sites be utilized for those services as well?
So I know our flu vaccination percentages were up. I don't have the exact ones, but I can definitely get that back to you. But at this time, we are using them for, testing sites. So kind of doing a trial run there. If you remember, we launched a program too, where we were going into homes to provide flu, which went very well. And we still offer flu vaccines, in our individual offices, by appointment only. There's not been any talk about providing flu here. Again, kind of just when we get ready to provide COVID, when we have it, it's best if the nurse kind of has that one vaccine to give, over time. But I know overall through the state, flu vaccines were up early on. And I think that was our messaging obviously got out and people actually were getting more vaccine than what we've seen in the past years.
Great. Good.
Good news. On the rate.
Okay, that would be wonderful. And you mentioned in terms of like the eligibility, obviously the state's going to be making the determination of like first wave, second wave, future waves. And you said the state has some flexibility. Do counties have flexibility on top of that? Is there any talk about some discretion based on unique need in a respective area, region, et cetera? What are those conversations like?
Yeah, so the conversations that we've had at this point, that ACIP would set, or that's that federal agency would set the priority, and then states have the opportunity to say, based on, local data and other information, that can be modified. That's just a recommendation, right, based on where they see the greatest need. And so I feel strongly that very soon the state will decide how that's going to be distributed and what their recommendations are as well. I'm sure locally, if we see a need, that's definitely something we could work with the state on and discuss how, what we feel Oakland County needed if it was very different than what the state had recommended.
Great, thank you. And then the last question, this is mostly for those who are watching at home or wherever, on whatever device you're watching on. Can you give the nurse on call number for people to schedule their appointments for a host of things, from flu vaccines to testing to and COVID vaccinations when the time comes?
I would love to. So it's 1-800-848-5533. So we are open Monday through Friday, and then we're also open, and that's 8 to 6. And then on Saturdays, we are open 9 to 12.
Fantastic. Okay, last call for questions for Leanne or Tom. Okay, seeing none. I guess, again, it's been stated already. We thank you both and your entire teams for all that you're doing on this and keeping us abreast on the developments and our preparation to kind of get through this next phase and hopefully the final phase to snuff this virus out as best we can. So thank you very much.
Thank you, Commissioners.
All right, that will move us to the regular agenda. We have 3 items. We're going to start with what was originally item 2 on the agenda. And so I need a motion for reallocation of coronavirus relief funds to create Open Together Restaurant Rescue Program, moved by Commissioner Wiper, seconded by Commissioner Jackson. I believe we have Mr. Deputy Executive Sean Carlson that's joining us, and who will take us through conceptually what this is and how we can help lean in to help support our local restaurants who meeting during this entire COVID event. So, Mr. Carlson, the floor is yours.
Yes, thank you, Mr. Chair, and thank you, Commissioners. Just take you through this. I will try to just kind of stay at the high level. Of course, the restaurant relief package is for those small businesses, restaurant, dining in services that, of course, were hit like all other small businesses at the front end of this pandemic, but also have recently suffered some financial hardships with the recent pause given the health orders, and we're in that pause phase right now. What we're attempting to do with this program is really a three-pronged approach. The first prong is to use CARES funding that we have remaining. We have until the end of December here, and we do have funding available to support these small businesses, dining services, with a meaningful grant. And I say meaningful, we're looking at would be $6,000 to $8,000 to these restaurants. Now, we do not have enough time, given the time frame, to have a grant application period. So what we are proposing to do is to take all the small business owners that applied through either the stabilization grant that took place last March, April timeframe, the recovery grant, which was open from July all the way to September, and then the restart grant as well. And all of the restaurants that were approved in that process, we would take those restaurants that have already been vetted and then do a modification to their current grant for economic assistance and send them additional funds. We would send them, like I said, probably on average would be a $7,000 check. We would have to use fulfillment services, which is we've used fulfillment services for our restart grant, which is basically we would be using FedEx to deliver these checks to the restaurants. So that is the first prong of this. And again, that would be use CARES Act. And then the second prong is $2 million. We're asking for general fund dollars for this. This would be for weatherization grants. And the reason we're asking for general fund dollars for this, there is CARES Act, but we do not have enough time because CARES Act is more than just obligating and encumbering the funds. Services have to be rendered or goods have to be delivered by 12/30. So that is why I'm recommending the $2 million for that. The weatherization grants speak to those folks that are trying to keep their businesses open, move to the outside, the igloos, the heating lamps. You've seen them, throughout Oakland County. And then the third prong would be $1 million to help our restaurants reopen safely when they are allowed to reopen. Help them with PPE supplies, as well as contact tracing. If anybody visited a restaurant shortly before they closed down in November, you may have had a piece of paper handed to you and asked to put your name and phone number on it and so forth in case something happened. So we would be looking for part of those funds would be utilized to have software applications to help with that pandemic and with contact tracing activities. So that's kind of a three-pronged approach to this restaurant relief package, and I'm happy to answer any questions. I know Commissioner Kuhn, you sent me a number of questions earlier today. I do have them here. Hopefully I've been able to answer some of them through this presentation. If I missed any of them, I'm happy to answer any of those that I may have missed.
Great. Well, let me go down the list of questions. I mean, people raise their hands. Commissioner Taub, if you want to, I'll give the floor to you.
Yes, Sean, thank you very much for everything you're doing. And I just want to know, when you send those checks out, which will probably be within the next week or so, do they have to be cashed by the 30th?
Yes, they do. Very good question, Commissioner. And we did that on our restart grant too, just to give you, to take a step back and speak to that aspect. We had $11,045,000 of checks that we have distributed. And we started that process the beginning of October. We were able to distribute all but 200,000. The checks became stale as of November 20th. Now, there are a few companies that got in touch with us, and we were able to write them a follow-up check, but we don't want anybody's check sitting in the back seat or on a counter or something like that, because that money will be lost. So that gives you an example. We would make those checks stale, Commissioner Taub, if in fact they weren't cashed by December 30th.
Thank you, Mr.
You're very welcome. And I guess I just want to, also congratulate Sean, the economic development team. I know we've learned a lot through this process about moving huge sums of money out to individual businesses. I would say argue faster than any other county in the entire state. And we're going to prove it again that because we have the infrastructure in place to be able to push this $7 million out quickly. And to be able to meet our end of the year deadlines and be able to launch this restaurant rescue program is really tremendous. So I know there's a lot of work going into that. Commissioner Gershenson and Commissioner Spiz.
I have to echo for getting Woodward's gratitude towards the administration for getting this together. I mean, by several of my local restaurateurs, and I feel we are really responding to their serious need. And I'm very supportive of the program, and I understand why you're giving to restaurants that have applied for something before. I'm a little worried about the ones that are just hearing about it for some reason, and I'm wondering, is there any sort of list maybe we could keep of restaurants that hadn't received anything in the past, that are just hearing about it, and that maybe we could do a really quick turnaround at some point? I just hate cutting off those that are late to the game.
Yeah, I definitely hear your concern. I'm just looking at bandwidth, and unfortunately, it's not just this program that we're drawing to close. We've got 25 different projects given the holiday season in which we're in. I'm trying to be realistic with this process. I will say the other two prongs that I just mentioned, the $2 million for the weatherization grants and also the $1 million, our preference would be that those grants go to those that did not receive dollars from this restaurant relief package up in phase one, as well as if they had not received any other. So they will be given preference for those other two prongs. So there will be a grant program that will kick off on December 15th. And since it's general fund dollars that we're talking about here, that would be open until the middle of March.
Okay, so, but in that fund, it's not any sort of grant relief, it's for the second two phases.
That is correct. That is correct.
To that point, Commissioner Gershenson, one thing is if we can get another COVID relief package through Congress, it might create an opportunity to be able to help support restaurants going forward. And I know folks down there are working on it. Next up, I got Commissioner Spiz.
Thank you, Mr. Chair. Two questions for Mr. Carlson. First one, is there any way we can distribute to the commissioners those restaurants in their areas that are going to be receiving this so that they can put calls into them and make sure that they're aware that the checks are coming and they don't sit on them and then they can push them through?
Yeah, absolutely. We do have that information and where they're at, and that would be very much appreciated. I know it was helpful when we were looking for some of our veteran service organizations. I had sent out some communication to our commissioners to identify those organizations because that was a little slow going. But that's a great suggestion, Commissioner Spiz, because we want to make sure when the FedEx guy drops off the check that they don't put it on their kitchen table and forget about it for 2 weeks.
Agreed.
We need to get them to deposit that as quickly as possible, and your communication will be helpful in doing that. So yes, we will get that information to each of the commissioners.
Great, thank you. My second question, you mentioned general fund. Is this coming out of CARES Act funds or general fund money? 'Cause if it's
7
general
million.
fund, we don't have a deadline, do we, if it's general fund?
That's correct. So $7 million is CARES funding. The deadline, that is economic assistance with a check. Prong 2 and prong 3 of this approach would be $3 million being appropriated from fund balance to those programs, and therefore the program would go until March 15th. And
Perfect, okay.
that is why we're proposing that. We believe because of the eligibility on payroll, that some of that money will drop into the fund balance and we can replenish the fund. And that's why we're proposing that, because we did not want to be unrealistic trying to push out $3 million for weatherization grants and everybody trying to get those services rendered and commodities delivered by December 30th. So.
Perfect, makes perfect sense. Thank you.
Thank you, Commissioner. Next up, Commissioner Kuhn, I know you had sent some questions out. Are there additional questions that you have for Commissioner Carlson?
Yeah, thank you, Mr. Chair. A couple questions, Sean. And again, I appreciate your response to some of the questions so far. How many restaurants are in our universe here that are eligible for this $7 million CARES Act funding?
About 1,000, a little over 1,000 restaurants that have, and what we're calling eligible at this point in time is small business restaurants that were approved in one of the 3 prior grant programs.
Okay, and if I understand you, and again, I'm shifting a little bit here from the CARES program to the county funded program. Are you saying that this is going to be similar to what was done in the recovery, that is a rolling type of application payment period from December 15 through March 15? Or if not, how do you foresee that?
Yes, it would be a rolling application that we would be looking at in regards to the weatherization program, as well as the Reopen Safely program, which is with PPE and so forth. So yes, that is correct.
Okay, and I understand it's easy enough that you can contact the people who've already, the restaurants that have already applied to you. How are you expecting to market the phase 2 and 3 so that, I know Commissioner Spiz has mentioned having commissioners involved. How are you guys planning to market it so that people know?
Yeah, well, one thing that we were able to do as part of the recovery grant, and you were an alternate on that oversight committee, was we were able to provide meaningful grants to our 22 local chambers. Part of the agreement with the local chambers is that they would be active partners with Oakland County. So it is our intention to leverage those chambers to communicate to those communities those new programs that we're talking about, as well as listing it on our website. But that's one of the key ways that we intend to communicate, because it's our local chambers and our DDAs that really have the pulse of each of these communities.
Sean, with regard to, again, I'm just talking about phase 2 and 3, are you expecting this to be a reimbursement thing, or is there some limit to the grant amount?
We haven't put all of that information together. We would look at a reimbursement and with receipts up to a certain cap, but that hasn't been established yet.
Okay, and one other question. Why wait till April 30 to give us a report? Is it possible for us to get some reports prior to April 30th? Again, we're talking phase 2 and 3.
April 30th, I'm sorry. Help me understand that piece.
In the resolution, it indicates that we're going to get a report on this on April 30th.
Oh, we'll give you reports along the way. I think I think that portion was probably put in there as just a closeout report.
Okay, and I know that you've been able to give the Oversight Committee very prompt report, so I was just a little curious about why it would be till April 30th.
I don't think I added that portion in there, so.
Well, I think that was put in because the weatherization and the safe reopen stuff, and it goes to the middle of March, and so giving time to close that out. But I think the team has been more than willing to give additional reports, and if we want some additional language, Commissioner Coon, happy to consider that.
Okay, great, thank you. And with regard to the new, I guess, with regard to the CARES program as well as phase 2 and 3, are we going to, if we approve the new oversight committee, will that committee be dealing with those 3 programs, or how do you foresee the oversight of it?
A great question. The thought process is that that resolution, which is next in the queue, they would have oversight of the $7 million. I would see a different committee involved with the other 2 prongs that we mentioned, the other $3 million.
Okay, and does that mean it's going through the regular committees that are set up as of January 1st, or is it you're thinking of some other kind of committee setup?
I mean, we didn't draft that in here. I have no problem with the committee setup. We didn't contemplate that piece.
Okay, all right. Thank you very much, sir. Appreciate it.
Thank you, Commissioner Zach.
I'm not sure that this is in your purview, Sean, but as I walked around downtown Royal Oak last weekend and saw all these igloos and accommodations, are those safe and healthy for COVID? You know, I just, when you see that igloo, there's some ventilation. You know, what is the recommendation from the county?
You're right. Our safety folks, our health folks aren't on here, but I imagine there's, it's been my understanding that there's some, as they have new guests come in and out of that, is some disinfecting that is.
So they're spraying them down. Okay.
Yes.
Yeah. I can speak a little bit to that, Commissioner Zach, because I too, and looking at your schedule, just to have some sense of normalcy in this time, but not only do you reserve them for blocks of time, and then staff comes in with technology to fumigate and everything to make it, safe and secure after that, and it's not commingling people, it's not multiple people. When it's a family that comes together and they're holding very hard to the state referendum. Yep.
Yeah, I understand their pods, so there is some type of disinfecting. Okay, thank you.
Yep. Okay, great. Any further questions on the restaurant rescue program? Commissioner Kuhn, for a second time.
I'm sorry. Thank you, Mr. Chair. I just have this, it's sort of a procedural question. We talked a little bit about having a different reporting language. Is it possible that this resolution, even if it passes unanimously here, goes on the regular agenda?
Certainly. I think there's not a problem there at all. We can work on that as well as the kind of the coordinating committee language, and we'll work with staff to do that. I already sent that message off to staff to start working on that, so we'll be good.
Thank you, sir.
Mm-hmm. Okay, Commissioner Top.
I have one quick question for you, Sean. In doing a little bit of research, I learned that there is a robot that is being used by airports. Very expensive. It's about $50,000. I know that's a lot of money. And it's being used to disinfect airports from all types of viruses, COVID and anything else. And it's used during downtimes or when sections of the airport closed. Have we thought about anything like that for our courthouse?
Have we thought about anything like that for our courts? Is that what you asked?
For our courthouse, the entire courthouse. So it could be virus-free, and cleansed, not just surface cleaning, but air cleaning. That's where apparently we have all this problem.
We did, I'll have to talk to facilities. I know facilities has purchased different equipment along the way. I'm not sure if they purchased something like that. I will reach back to Tom Hardesty. I know on our Safe County Operations Oversight Committee, I'm not aware of any requests for that to be purchased. But I am aware of what you're speaking to, because I do know some school districts have made those investments as well. So,
All right. And Mr. Carlson will go back and get that information. Try to keep this focus on the restaurant rescue package, but I saw Commissioner White's hand go up, so I'm going to give latitude if there's a response to that.
I was over at the court and I think they told me they had some kind of machine like that. So, but let's stick with restaurants.
Okay, great. Any further question on the resolution, the restaurant rescue program that we hope to approve next week? If asked by this committee, seeing none, Madam Clerk, would you be so kind to call the roll, please?
Certainly. Commissioner Gershenson?
Yes.
Biz?
Yes.
Zach?
Yes.
Jackson?
Yes.
Lubes?
Yes.
Miller is not here, correct? I think he joined her. Nelson?
Yes.
Taub?
Yes.
Wipert?
Yes.
Kuhn?
Yes.
Woodward?
Yes.
Chair, 10 yeas, 0 nays.
That's excellent, and this will be placed on the regular agenda, and with the likelihood of entertaining some technical amendments to address the comments that were made during the discussion. Okay, they'll move us to item 3, miscellaneous resolution 20624. I get a motion. This is authorized payment to the Board of Canvassers for the Oakland Together Local Government Partnership Grant to support hazard pay for our 4 Board of Canvassers. Is there a motion? Moved by Commissioner Zach, seconded by Commissioner Jackson. Any discussion? Commissioner Gershenson, I guess, since I introduced it. I'll put the context after, but Commissioner Gershenson, go ahead.
Okay. Thank you, Mr. Chair. I will not be supporting this. I feel to single out one group of employees when so many have given exemplary service, I'm just not comfortable with it.
Certainly. I know that this is an issue. I know that the Democratic caucus has talked. I think some of the Republican members have discussed. Remember that we authorized democracy incentive, basically hazard pay for our poll election workers. These are our Board of Canvassers are appointed 2 Democrats, 2 Republicans. They serve a critical process, as we saw demonstrate and play out across the state, to certifying the election, and after the 14 days after the election, certifying to make sure all the tabulation and all the records are correct. They do that at our county complexes. So there are some additional controls that are put in place, mask wearing and other things that are enforced, because we can control that coming into our buildings, whereas it's a little bit different for poll workers. But you also have the numerous upwards of 50 local units and municipal staff from all over the county coming in. And so when I know it was proposed by the Board of Canvassers and talking to the chair of the board, Ms. William Cotton, I thought it was appropriate to bring to this full group for consideration. So the proposal is $50, additional $50 per day above what they're currently making for this last election. That's basically it in a nutshell. Any further discussion? Seeing no discussion, Madam Clerk, please call the roll.
Certainly. Commissioner Spiz?
Yes.
Zach?
Yes.
Jackson?
Yes.
Lubes?
No.
Nelson?
No.
Taub?
Yes.
Wipert?
Yes.
Kuhn,
Yes.
Woodward,
Yes.
Gershenson.
No.
Mr. Chair, 7 yeas, 3 nays.
Sufficient number voted in the affirmative, will be recommended to the board for consideration at our next board meeting. This brings us to our last item. We go back to item number 1. And this is Board of Commissioners consolidate of coronavirus relief funds, oversight and committees, authorization to disperse and reallocate grant program funds. We need a motion. Moved by Commissioner Jackson, seconded by Commissioner Taub. And I believe we have Hillary yep, there she is, Chief Deputy Hillary Chambers, to explain the intent and purpose for this resolution as we close into the December 30th deadline, all things remaining equal at this moment.
Well, thank you very much. And this is probably a good opportunity to thank the Board of Commission staff as well, because while we have shuffled around the agenda, they've been feverishly working to make sure that the resolution accurately portrayed everything that we needed to portray. And they have done that, you know, really since the beginning of the pandemic, making sure that everything went smoothly in terms of things that we needed to get over to the Board of Commissioners for your approval. So we do very much appreciate all of the support that they've provided as well. So yes, as the chairman said, this is our kind of end of year resolution, and it feels like, you know, just yesterday that you were voting to accept the $219 million of CARES Act money from the federal government. And now what this would do, it would allow us to kind of land the plane by the end of the year. And it consolidates all of the oversight committees and all of the resolutions under which you've appropriated money into one oversight committee so that we can reallocate funds from between those programs and spend the remaining funds on, you know, on like initiatives that support the community by the end of the year. So I think the oversight committee process has worked well. You know, we made a commitment even during the state of emergency to try to follow as closely as we could normal order. I do know that there are times when, you know, we fall behind and we don't get things to the board as early as we should or that you would desire. And we all, I think, are committed to improving the timing of things. But this resolution is really what it says. It's a reallocation resolution so that over the next 3 weeks, we can work in hand in glove with the oversight committee and just do what we need to do to spend the remaining funds. I will, and I'm pleased to, as all of you know, the CDT program closed on November 30th, Monday, the library program, the school program, you know, so everything that we have been implementing over the last few months is winding down. And so we will have, you know, just a short sprint really to reallocate to some remaining priorities. And that's the intention of this resolution.
Thank you. We got Commissioner Tom.
Thank you, and thank you, Hillary. I don't think you signed up for a pandemic either. I have a couple of questions. The first one is, we do sine die, so how are you going to continue this committee from today until January, past January 1st? Or are you going to reinstate it on the 1st of January?
Well, to that point, Commissioner Taub, the purpose of this entire committee is to make sure everything's done by December 30th. I mean,
okay.
Dollars are not spent. I mean, as Deputy Executive Carlson mentioned, goods purchased, services received by December 30th, the money has to go back to Washington.
Okay. Now, my second question, may I continue, Mr. Chair?
Sure.
Thank you. 1, 2, 3, 4, 5, 6. The sixth, somebody just called on my cell phone. The sixth from the bottom, be it further resolved, reads, be it further resolved that the Oakland Together Coronavirus Relief Fund Coordinating Committee is authorized to enter into professional service contract. Well, that negates the Board of Commissioners. We have always approved contracts, haven't we? After they went to committee.
If I can, Matt, or Mr. Chair, on this, this is consistent with the same language of every oversight committee resolution that we've adopted to date. So it was just incorporated in here in order to consolidate the other oversight committees.
Right. I mean, basically, we are, I mean, as a board, giving authority for those contracts to be issued because they have to be issued, services rendered, goods purchased by the end of December 30th.
Okay, so the full board is not going to approve any contracts before December 30th, is that correct?
Yes, I mean, you asked about professional services. I mean, there's two different whereas clauses. There's the whereas clause about professional services, and there is a be it further resolved about contractual agreements. For example, I'll just give you one example, and this is the back and forth that we would have with the oversight committee. But, you know, if we have remaining funds, and right now the estimate is that we could have, you know, $15 million of remaining funds. You know, there are institutions within the county that we haven't supported. For example, Oakland Community College. So we have asked OCC to prepare what might be eligible expenses so that if we ever had money left over, we could consider that. If that's a decision that the Oversight Committee agrees with, then we would need a contract with them. And this resolution would give us the ability, if we had extra money, to sign a contract with OCC and provide them with $250 or whatever it is that they have in eligible expenses by the end of the year. That's the intention of these whereas clauses.
I still struggle with that we don't have full board approval. Maybe, Mr. Chairman, you can figure out how to get full board approval after, do you understand where I'm coming from, without having to convene the board? I don't know. I don't know how it can be done.
Yeah, Commissioner, to your point, I mean, this is the dilemma. I mean, we have worked really hard to create, I mean, like the CBTs, like all those grants come through and that deadline was the 30th, so that anything left over will be taken up whatever came through that and get in through this current board meeting. I just think it's the nature of the timing because December 30th, the dollars have to have been moved, used, services received and everything. We don't have a lot of, I mean, there's just not a lot of time. And
okay, so let me just put it this way. If by chance, maybe we can ask for an amendment that says, and I'm paraphrasing and being silly about it, but if by chance that this deadline is extended, then it would have to come to the Board of Commissioners. Is that a fair thing? In other words, you don't know, right now, December 30th is the deadline, but there still is a possibility that this funding could be extended.
So Commissioner Tubb, I mean, along that point, I think we're on the same wavelength. If you read the very last be it further resolved clause.
Yeah, go ahead.
You know, if you read the very last one, it says that
okay.
That the provisions of this resolution shall be repealed immediately upon an extension of the deadline, which would give us more time to do. I mean,
okay. All right. I didn't catch that one. Okay.
Yep.
All right. I'm still not happy, but I will support it. But I still think there has to be a way that you can get. Is there any way you can send these all to the whole board and we can sign off on them without convening a separate meeting, just a list of them?
I mean, I think that, the recommendation of the Oversight Committee can easily be sent out to the entire Board of Commissioners. This is how we're expending these dollars, and so we can definitely get that out there. Any contract requires my signature, and we also have a bipartisan Oversight Committee looking at it. And betting that we're talking about the final remaining dollars. In a perfect world, everything would have been spent, to the projections when we set up all the Oversight Committee, and now we've got a little bit of dollars that's available. And I think Chief Deputy Hillary Chambers did a very good job. We want to make sure that we push these dollars out to anything that's out there. And the example that she gave, already doing the footwork to identify where are eligible expenses that are out there so we can move fast, because we still have to approve it and make sure it qualifies as a care expenditure. and we can get the check written, cashed, done. And we have 3 weeks. And in that 3 weeks is Hanukkah and Christmas and New Year's Eve. Well, it's technically New Year's Eve is on the 31st.
All right, I'm gonna hold your feet to the fire then, Mr. Chair.
Absolutely,
Thank you.
absolutely.
Thank you.
Any further discussion on the resolution? Commissioner Kuhn.
Thank you, Mr. Chair. I just had a couple questions. If I understand what you're saying, Hillary, you're saying that there's 15 million. Is that in addition to the 7 million that we may reallocate for the restaurants?
No, that includes that.
So it's at 15 total.
Yeah.
Okay. And I know we've been told a couple times that there have been changes to this. Do we know what the changes are?
Yeah, I can put that amendment up on screen if you're ready for it, Mr. Chair.
Yep. Yeah. So we need an amendment. Commissioner Kuhn, you have any other questions? And then the amendment to the text. We'll get to the amendment after you're done with your question.
Oh, I see. Okay, so that's going to be an amendment. I appreciate that. Again, I just am a little leery. I mean, throughout this whole process, the administration has been very quick to give us reports on the oversight committee. I don't really think that 60 days is needed. I mean, we've been getting much more prompt reports than 60 days afterwards. So that's a concern that I have. If 60 days are really needed, or if we can get some sort of report before then.
Thank you, Commissioner Kuhn. Yeah, so if we could put up the, Mr. Ward, if you can put up the amendment that I know that you've been working on drafting.
If I can, Mr. Chair, just give a quick explanation of why this is necessary.
Well, how about this? So can I get someone to move this amendment? Moved by Commissioner Taub, seconded by Commissioner Zach. Yes, please, Mr. Ward, give the explanation of why we need to change some of the language in this, be it for the resolve clause.
Okay, thank you. This is a fairly straightforward issue. As originally drafted, it was contemplated to authorize this coordinating committee to approve interlocal agreements. That is a statutory Board of Commissioners. And so how we've handled this in the past is we've approved like template standard agreements to allow programs to move forward. So that's the intent and the purpose of this amendment is to give authority for the specific programs that are named, and there will be attached template agreements for each one of those programs.
And these are, correct me if I'm wrong, these are the agreements that for all these programs that we use that comes before the board, that when we approve the interlocal agreements, this is authorizing those same agreements to be issued if dollars are used for any of those type of things.
That's correct, Mr. Chair. Just again, a necessary thing to be in conformance with the law and the various programs, the CVT, the senior library, the road commission, the school program, and our school drinking water program.
And so any recommendations would require not only review by Corporation Council, approval of the coordinating committee, the COVID Relief Funds Coordinating Committee, and then that, and we'll be able to report all of that to the full board.
That's correct, Mr. Chair. This is sort of a safeguard in case we get applications that are worthy after the deadlines that have already been established. I don't think there's necessarily a full intent to utilize all of these provisions, but it's just to give the flexibility in case one of your communities comes in with an application or some issue happened with their application prior to the deadline.
And I'll just give you one example of that. There's two actually that might, just so you understand. I'm hopeful that we'll get the road commission over to you by Monday. They wanted to be able to submit their November expenses. And so that's why we haven't brought it over to you yet. So we need to get their full November expenses and add that to their submission. And so that one is a bit of a timing issue. You know, Chris has the interlocal agreement. We've agreed to it with them. We know what majority of their eligible expenses are, but we wanted to give them time to submit their November expenses. And then Chris indicated another example, which is, for example, another one, schools. We've received every school district except for one. Okay, I'd like to give that person a chance to get their submission in. And so we might need the flexibility to get one submission in. So those are just why we need this language.
Great. Any questions on the amendment? Mr. Ward, if you can take down the screen so that I can see the curly whites and eyes of everyone here. All right. Any further discussion on the amendment? Madam Clerk, please call the roll on the amendment to the resolution.
Thank you. On the amendment, Commissioner Zach,
Yes.
Jackson,
Yes.
Lubes,
Yes.
Nelson,
Yes.
Taub,
Yes.
Wipert, oh, is he not there? I'll skip him and come back. Kuhn,
Yes.
Woodward,
Yes.
Gershenson,
Yes.
Spiz,
Yes.
and Wipert's not back yet. Mr. Chair, you have
Go ahead.
9 yeas, 0 nays.
Sufficient number voting in the affirmative. The amendment is adopted. And brings us back to the main motion. Is there any further questions for Deputy Executive Chambers, or Mr. Carlson, or staff?
Mr. Chair, I quickly drafted one to include the last program you just adopted under this umbrella. If you'd like to consider it now, a fairly straightforward amendment.
Sure. Can you put it up on the screen?
Yes. So this would just capture the restaurant rescue program you just adopted.
I'll move it.
Yeah, a move by Commissioner Spiz, seconded by Commissioner Taub. This is, pretty straightforward. All in, any discussion on the amendment? Seeing none, Madam Clerk, please call the roll on the amendment.
Certainly. On the amendment, Commissioner Jackson,
Yes.
Lubes,
Yes.
Nelson,
Yes.
Taub,
Yes.
Wipert, Kuhn,
Yes.
Woodward,
Yes.
Gershenson,
Yes.
Spiz,
Yes.
Zach,
Yes.
and Wipert's not back yet. Mr. Chair,
Yes.
9 yeas, 0 nays on the amendment.
Sufficient number voting in the affirmative. The amendment is adopted. Brings us back to the main motion. I think I thought Commissioner Spiz's hand. Did you
Yeah.
have a comment on the original resolution?
I have a comments last question and to maybe to you, Mr. Chair, and I'd like the whole committee to kind of pipe in and get their thoughts on it. The committee that's being formed that all these are going to be moved into one group is going to have 2 of the majority party, 2 or 1 of the minority party. Does everybody think that is enough representation, or should we increase those numbers relative to the commissioners? Since we're going to be pushing so much through this in such a short period of time, should we increase those numbers for representations on this oversight committee? I'm thinking yes, but I'm not, I'm not overly against where it is, but I think it would be good to have more representation is my thought.
How about, I'm willing to work with you, Commissioner Spiz, to kind of talk through that and see if there's a way to
That's
address
fair.
that. We can, I'll have this one placed on the regular agenda on the,
All right, perfect. Thank you.
Commissioner Taub.
Yes, as I look at the, be it further resolved, the first one from the bottom, it says, 2 county commissioners from majority party and alternates. And then it says 2 county commissioners from the minority party and alternates. But the number in front, in parentheses, is 1. Which is it?
I'm trying to pull it up. Where did I?
If I can, Mr. Chair, that might have been a typo on our part, on the staff's part. I think the intention was 1.
How about this? Why don't we just leave it as is now, and we will address it on the floor in conversations with Commissioner Space.
Okay, then it's gonna go on the regular agenda? And it's not correct. Thank you.
Yes. Any further discussion? Seeing none. Madam Clerk, please call the roll on the resolution.
Thank you. Commissioner Loobs,
Yes.
Nelson,
Yes.
Taub,
Yes.
Whitebird, out there, Kuhn,
Yes.
Woodward,
Yes.
Gershenson,
Yes.
Biz,
Yes.
Zach,
Yes.
Jackson.
Yes.
Mr. Chair, you have 9 yeas, 0 nays.
Sufficient number voting affirmative. The resolution is referred with recommendation, and it will be placed on the regular agenda. And we can, outstanding issue, we will resolve on the floor. All right, that's the only 3 things that were on the agenda. So thank you, Chief Deputy Executive Chambers and Deputy Executive Carlson.
Thank you.
Seeing no further business coming before the committee, I'll declare the committee adjourned.